We will begin with managing COVID leave in the dental office with Kathy Albrecht, who is ADA's Senior Associate General Counsel. Kathy?
Yeah, we've been getting a lot of questions, and frankly, we've been getting a lot of questions from a lot of you, so I know that you folks are asking. This has been a sort of a difficult general question to answer because there's a lot of moving parts. And in fact, we were kind of figuring it out until there was a recent decision in the Southern District of New York that declared some of the Department of Labor FAQs on this issue invalid under the Administrative Procedure Act, blah, 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 blah. But what it's done is that it's sort of put things back in flux again and given us a little more, I think, more guidance as to how we can proceed. Now, with that said, I don't have that many slides, but it's kind of complicated because there's a fair amount of if then, you could do this, you could do that. So I'm going to ask that everybody, if you can, save your questions, write them down if you need to the end, because I think it may be the case that after we, after we finish the slides, some of your questions will be answered. Next slide, please. So this is the question. What if one of my team members needs COVID-related leave? What are my options? Well, I think as we all know, and this is the first big part to chew on, under the Families First Coronavirus Relief Act, every employer with 500 or fewer employees must pay up to 80 hours for full-time folks or prorated equivalent for part-time folks of time at full pay with limits up to a certain amount a day and in the aggregate if the employee is unable to work from home and one of the following three scenarios applies. So the first one is the employee is subject to federal, state, or local quarantine or isolation order related to COVID-19. This has come up in the context of, okay, what if one of my staff travels to Florida and doesn't wear a mask and comes back to Illinois or another state that's restricting and requiring quarantine upon return? Do I have, at least on the face of it, do I have to pay for that time? The answer is yes, but it's going to be qualified. So that's one reason. Another is the employee's been advised by a qualified healthcare provider to self-quarantine due to concerns related to COVID-19. And this has been interpreted a healthcare provider who can actually diagnose a COVID-related situation or someone qualified to render that opinion. And the last one, and this is one that maybe is a little more problematic for some folks, the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. So it's not just that I have a cough and I'm really worried, so I really want to stay home. They have to demonstrate that they've been seeking a medical diagnosis. So it's both of those things. Now, so that's pretty straightforward. Can we go to the next slide? And the next question I get is, really? Yes, but that's just the start of the analysis to figure out whether or not, the practice may choose to pay folks or to find some other alternative. So under these first situations, the person doesn't have to have worked for you for more than a day. There's no tenure requirement for folks to be eligible for this kind of leave. And there's also no requirement that the FMLA used to apply to the practice, which only applies to practices of 50 employees or more, and basically provides family and medical leave generally. Any employer, any under 500 are going to be subject to this analysis. Now, one of the things that we learned very recently, or at least the guidance that we got from the lawsuit filed in the state of New York, is that it has been clarified that healthcare employees which would include dentists, are likely exempt at the election of the practice owner. So in other words, if you are a healthcare employee and you have COVID, the practice could say, no, I'm not going to pay you because I don't have to, because you're a dentist, you're a hygienist, you're an assistant. I have the option to exempt healthcare employees. But I think that the New York opinion, and right now it's the only one that is really any sort of controlling authority right now, this would not go so far, and likely doesn't go as far, to include office positions. So in other words, it's not any or every employee of the dental practice that may be subject to this healthcare exemption, but only those employees, healthcare employees, who actually provide healthcare services in some fashion or not. So, and now everybody's putting their hands up in the air and say, oh my God, now what do I do? I don't want to, I don't want to have to pay people if I don't have to pay them, but I also don't want to alienate them by saying, no, sorry, I'm not going to give you leave or give you paid leave. So the common sort of thinking on this, at least for the time being, is that what this means is that you can furlough your staff for the period of time. If you're taking a healthcare exemption, you can furlough your staff, and then they can collect unemployment. Or you just, it's not just the office positions, but the hygienists, the dentists, and the assistants, all of them can be temporarily furloughed so that folks can collect unemployment. Now, today's unemployment is a little different than yesterday's unemployment. So there may be, you'd have to run the math, but is it more beneficial for the $511 a day up to $5,000-ish, or how much would the person receive on unemployment? This is going to be, if it's not a concern of the practice, it will be a concern of the affected employee. And there's also, you don't have, in other words, you don't have an excuse to not pay this COVID illness related leave. It's not subject to whether or not there's work available. So let's say, tomorrow you close your practice because there's a big outbreak, and someone in your practice comes down with COVID or fits one of those three exceptions. They still would be entitled to pay even though your business is closed. So it's a little complicated, but if there's no work, then the same thing happens. You just put them on furlough. And functionally, the answer to a lot of this and a lot of the questions is, well, maybe you need to look at furlough. So next slide, please. So now, because we know there's a couple other different areas of potential leave here. What if a staff member requests leave because they need to take care of a COVID-affected family member? Well, if the staff, now in this case, the staff member has to have worked with the practice for 30 days, full or part-time. And if they have, they're entitled to up to 80 hours or prorated, as we've discussed, not at full pay, but at 2/3 of normal pay, up to $200 per day and $2,000 total if one of two situations is present. The staff member is needed to take care of a household member subject to a government or medical quarantine, an elderly parent, a child who's under quarantine, and the staff member is needed to care for them. Or the staff member needs to care for a child if the school or daycare is unavailable due to COVID precautions. So that's a whole nother analysis. Next slide, please. And now the next question, of course, is, are there any exceptions? And the answer to that is yes, with respect to only the school daycare leave. There is a small business exemption. And that is basically small business employers may be exempted from paid and additional unpaid leave requirement if doing so would jeopardize the viability of the small business as a going concern. And there's a number of different criteria that need to be satisfied or records that need to be kept. And that, by the way, is included in FAQs that are maybe a little more detailed than this, that have been revised and uploaded to the ADA site, and which were distributed to you, in advance of this meeting, and we can send it out again. But anyway, there is some more information on this particular exemption, but that is available to you. Now, with respect to this kind of leave, the needing to care for someone else leave in your house, does the healthcare exemption also apply to these leave reasons? And the answer to that appears to be yes. And finally, the question comes, and the big through line on all this is, can I furlough the employee and have unemployment compensation paid? And the answer to that question is yes. Next slide. So, are there any other requirements to extend COVID-related leave under this Families First Coronavirus Relief Act? And there is. There is if the employee, again, has worked 30 days or more with the employer. They may be entitled to up to 10 additional weeks of unpaid job-protected leave if more leave is necessary due to school or daycare unavailability. But again, that you could furlough in this situation as well. And the final one, and the one that maybe is kind of a trip up, but doesn't really apply to most of our practices necessarily, and that is that the practice already has 50 or more employees and meet the normal FMLA requirements for coverage. Those provisions will still apply. So if you did have a practice with 50 or more employees, normal FMLA provisions would apply, because this first 80 hours of paid leave for COVID, that's a one-shot deal. You only get 80 hours, you don't get 80 hours every time that might apply. But there may be situations if someone first they have to take care of a sick person and now they have COVID themselves. If you are in one of these larger practices, there would be normal FMLA, not paid leave protection necessarily, unless the policies provide otherwise, but job protected leave, in other words, you'd have to take them back after the 10 additional weeks. Okay, next slide, please. I know you guys have a lot of questions, I'm sure, but the key takeaways, that sort of the more global things that I see with respect to this, first of all, it kind of seems like this is a moving target, and it kind of is. I know it can be frustrating, but the key takeaways I'll take from this, at least as we stand now, healthcare provider exception does apply. We've got some authority for that. It wasn't clear before. It doesn't apply. It applies to some, but not all staff. In other words, the healthcare providers themselves, yes. The support staff, likely no. Unemployment compensation is available in lieu of having to pay the leave. But, and this is a big but, if you don't pay for the leave under the terms that are set forth, and instead you furlough the employees, you can't take the tax credit for paid leave, because there's an offsetting paid leave tax credit that's set forth in the Coronavirus Act. So yeah, you can't take the tax credit if you're not, if the state's paying for it. And maybe I think most importantly, because I've talked with some of you about this a little bit sort of generally and maybe more directly on this, I think we can't let slide the effect of however the practices decide to, handle employee leave and COVID, but consider the effect of the leave decision on the morale of people you care about and want to have return on good terms. I think sometimes, you want to think through these things and you kind of want to sketch them out, which is why I've said and requested that we save the questions till the end, because there are many variations on this and individual circumstances. You may one of you may choose to do something different than another of you may choose. So it's really not there's not a yes, no answer on this. There's a yes, if, then, but, more of that kind of situation going on here. So with that, I think that's all the talking I need to do. If we can go to the next slide and maybe start taking some questions.
Sure, sounds good. So what if an office staff person knowingly travels to a location that will require quarantine upon return, perhaps even warned, but travels anyway? Are you still stuck paying for 80 hours while they quarantine? And what are the consequences for a business for not paying?
Well, here, okay, that's a common question. And you go through the analysis. If it's the first time, and if they've worked for you for a day, then you do, and they're a full-time employee, you would need to pay for the 80 hours while they are in quarantine. Unless they're a healthcare provider, and then you can say no. If they're an office staff, you can also say no, but what you need to do then, and one of the consequences is, the way to avoid not paying is to put folks on unemployment or a furlough for a period of time during the quarantine. If you do that, they may be angry, they may get less money, they may be upset. I mean, that's a morale issue. But you also, one of the consequences for the business of not paying is that they don't get the tax credit. So you can't have it both ways. But really the short answer to a lot of this is a practice can put someone on unemployment. It's basically shifted in many ways. The burden of the practice, which frankly would be compensated for by tax credit anyway, shifts that burden over to the state governments, basically.
Okay, great. Does the unavailability of school daycare apply to hybrid schooling? For example, part-time remote and part-time in school. Is this considered school being unavailable?
It is in the sense that, and I haven't addressed this, this is another kind of complication, but there is such a thing as intermittent leave, like a reduced leave. So if the person needs to be out Tuesday, Wednesday, Thursday, because of the unavailability or the hybrid, there would likely be, and I haven't seen a case on this yet, but I would say there would likely be, because there is the option for leave, intermittent leave when it's necessary, but that would still qualify to an extent, would be my guess. And again, that's not a legal opinion. It's based on what I'm looking at and seeing so far what's been published. So it always is going to be fact dependent, but it will likely be intermittent. So.
All right, great. So if an employee needs time off during the week for education of children, can they be paid under the CARES Act?
I believe the answer to that question is yes, but I would need to defer to the government affairs folks. But again, I think that could be paid under this is my guess, it could be paid, but then you can't, you can't claim, well, the short answer is yes, I think it might be, but I think you better ask someone who knows better than I. So maybe we can defer that till toward the very end.
Sure, when Mike joins us, yes, okay. That sounds good. And then to claim the healthcare exemption to not pay the employee, do you have to file anything?
Well, I think you probably do have to, you'd want to ask your accountant on that. You would probably have to keep records at the very, I would say at the very least, how you handled it. But honestly, if you're not paying the employee, you really don't need to do anything, because the only time you need to would be if you actually paid them. Is the decision to furlough versus pay leave for each employee or for all employees in a given classification? There's no, that's actually a good question. unless you're basically, you know, covered by anti-discrimination laws and you're only letting white people, you're only paying white people, then that might be a problem. But no, it can't, it is an individual decision, as I understand it, and under this law. But it is theoretically employee by employee, but I think the wiser and safer choice would be to be a classification rather than not, unless there are individual circumstances that would say one should be handled differently than the other. I mean, there's a business justification for that, but I think I would start with the healthcare versus non-healthcare.
Okay, so we're not seeing any more questions related specifically to this, and I think that last Q&A can be handled at the end of the session. Oh, one more. With reduced hours by many practices, what is considered full-time versus part-time?
Well, and I can't answer that, and I'll stick around until the end, and if any questions pop up, I'll still be here. But there is a calculation for how to calculate full-time and part-time employees. It's very deep in the regulations. But what I would say on this, and I can't quote specifics, but what I would say is that it's going to look backwards rather than looking forwards to a greater extent than you may hope. Because again, as I say, the lack of work availability you know, doesn't prevent the employee from still collecting under these, at least the first three COVID illness related exceptions. So I think the safest choice on this is probably to slog through the regulations, which is a nightmare. But I think you need to think more about what it used to be, unless you have a case to be made that you have a new normal. But still, what's going to guide it are the regulations on how to calculate.
Okay, great. All right, it doesn't look like I'm seeing any more questions here. So Kathy, thank you so much for taking the time to do this today.
Wonderful, great, thanks,
Right.
thanks for having me, bye-bye.
Thanks, Kathy.